O is a 25-year-old woman who comes into the unit complaining of fatigue and abdominal pain. When asked about her symptoms, she admits to having nausea, vomiting, and constipation. She leads a busy lifestyle, holding down 2 jobs, and has had recent weight loss, which she attributes to stress and poor nutrition. Previously, she had been diagnosed with Crohn's disease 6 months prior, but this is her first time since her diagnosis that she has come in for severe symptoms. Mrs. O is currently on no medications, but she is a regular smoker.
Come in.
Miss Natalie,
Yes.
how are you? My name is Jordan. I'm a patient care tech. Is it okay if I take your vitals right about now?
Yeah, sure.
Awesome. Do you have an arm that you prefer?
This one.
That one, okay.
Come in.
Hi Natalie, how are you?
I'm alright.
Hi, well my name is Camilla and I am a nurse here, and we're just going to be talking about, what brought you in here and see how we can help you, okay?
Okay.
Alright, so can you give me your name and date of birth, please?
Natalie Ondurko, 10/22/97.
Okay, and can you tell me where you are?
I'm at Eastern University.
And can you tell me why you're here?
I've been having really bad abdominal pain and vomiting.
Got you. Okay, and can you tell me today's date?
April 18th, 2023.
Okay, well if you don't mind, can you pull your gown up so I can look at your stomach, and I'm just going to lower the head of the bed if that's okay.
Mm-hmm.
All right, and also if you could just bend your knees and bring your heels to your butt. I'm just going to look. Okay, so I do see some distension. If you don't mind, can I listen to your stomach?
Sure.
Okay. Any tenderness or pain,
Not so much there.
just let me know where it starts to hurt at.
Oh, right there.
Right there? Okay,
Yeah.
so your right lower quadrant, is that where you have
Yeah.
most pain at? Okay, all right, so that is good to know. I would definitely let the doctor know that's where the pain is stemming from, okay? All right, Miss, so I'm going to set you back up for the rest of my assessment, okay?
Okay.
And you said that you feel better when you're sitting up.
Yeah, it's just when I'm laying flat and my legs are straight. It's really uncomfortable.
Okay, well, I'm going to feel for your pulses. So I'm going to start with your radial pulses. All right, pulses are +2, and now I'm going to feel for your pedal pulses. All right, pulses are +2. I'm just going to check your capillary refill. All right. And it is less than 3 seconds. Okay, so Miss O, can you tell me, has anything happened to you like this before?
Sort of. I mean, I had like diarrhea and crampy abdominal pain the last time I came in, which was like 6 months ago.
Okay.
And that's when I was diagnosed with Crohn's disease.
Okay. And when is the last time you had a bowel movement?
Like 4 days ago.
Okay. Do you mind if I just complete the rest of my physical assessment and take a listen to your heart and lungs?
No, go ahead.
All right. Thank you. Okay, so first I'm going to start with your lungs. Once you feel my stethoscope, could you just take a deep breath?
Sure.
Thank you. Okay, and now I'm going to take a listen to your heart so you can just breathe normally.
Okay.
Okay, now I'm just going to finish my auscultation of your lungs in the back, if that's okay. So if you just sit up for me.
Yeah.
I do apologize.
This is
I know
hard.
you are in pain.
Yeah.
Can you just take a deep breath for me, please? Okay. So you mentioned that you were having some abdominal pain. When did the nausea and vomiting start?
That started about 2 days ago.
Okay, and could you rate your pain on a scale of 1 to 10 for me, with 1 being a little bit of pain and 10 being the worst pain that you have ever felt?
It's about a 7.
About a 7, okay. So I looked at your chart and I noticed that along with your Crohn's, you had a history of smoking cigarettes.
Yes, that's correct.
Okay. Do you take any other medications or herbal supplements or any illicit drugs?
No.
Hi, Mrs. O.
Hi.
Okay, so it seems that Dr. LeBoy ordered a few things for you, okay?
Okay.
He wants you to have an abdominal x-ray, a trans-abdominal ultrasound of your abdomen, and to get a few labs, specifically a CBC and a BNP.
Okay, I know what the x-ray is, but what are the other things?
Okay, of course. So a trans-abdominal ultrasound is used to examine the organs of the abdomen. An ultrasound transducer probe is pressed firmly against the skin of the abdomen. It is a painless procedure. And the lab tests that will be done are a complete blood count and a basic metabolic panel, which is a blood test that will allow us to look at your kidneys and how they are functioning, as well as your sugar and your electrolyte levels.
Oh, okay. Thanks for explaining that.
Absolutely, no problem. I'm here to answer any questions that you have.
Thanks.
No problem.
Hey Kay, I just got your message. What's up?
Hey, Dr. LeBoy, I had called you because I wanted to discuss Mrs. O's lab results.
Okay, what are they?
Okay, so the transabdominal US and X-ray show strictures and a bowel obstruction in the ileum, and her BNP showed low electrolytes.
Okay, so let's keep her MPO for now.
Okay,
Start her on 500 milliliters of lactated Ringer over the next 8 hours.
okay,
I'll also put an order in for Cipro, 400 milligrams per 200 mLs,
okay,
over 60 minutes Q8.
okay,
And then for her pain, we'll do acetaminophen 500 milligrams per 50 mLs, Q6.
okay, and you're just gonna put the order in for me so I
Yep.
can start it?
I'll get right to that.
Okay, thank you so much.
Mrs. O, how are you?
Okay.
Okay, my name is Dr. LeBoy. I just want to discuss some test results with you. Is that all right?
Yeah.
Cool. So, what we can do to move forward. For the diagnostic tests, they showed bowel obstruction due to strictures in your ileum. So what strictures are narrowing of the intestines in your stomach. So what that's causing the obstruction, which is inevitably causing your pain. This happens due to repeated cycles of inflammation and healing that occurs with Crohn's disease, which, from my understanding, you were diagnosed with a few months ago.
Yeah.
Okay. Your labs also revealed that you were dehydrated, so we are going to start you on lactated Ringer. So that's going to get your electrolytes within normal range. Your white blood cells were also high, so this indicates that you might have an infection going on in there. So we're going to administer an antibiotic as well to get you within normal ranges there. And I'm going to put in an order and talk to the nurse to insert an NG tube, which is going to help decompress your ileum. Okay.
Okay.
It's going to provide a little bit of comfort and make you feel a little bit better at least.
Will that help with the vomiting? Because I've been throwing up a lot.
Yep. Going to help minimize your chances of vomiting as well.
Okay. Thank
Yeah.
you.
Any questions for me?
Not right now.
Okay, perfect.
Come in.
Hi, Mrs. O.
Hi.
So Dr. LeBoy has told me that he talked to you about your strictures and the need for you to have an NG tube and to be on fluid and antibiotics.
Yes, he explained the severity of the strictures, and he also mentioned that I need an NG tube. Could you just explain why I would need that again?
Absolutely. So it is very important that your bowels rest and decompress. And the best way to accomplish this is to insert an NG tube.
Okay, I understand that. I'm ready when you are.
Okay, so I'm going to get your medicine together. And in the meantime, we will just continue to monitor you, and I will definitely update the doctor if anything should change, okay?
Okay.
All right.
Come in.
Okay, hi, Mrs. O.
Hi.
I have your medications here. And also the doctor also added some Tylenol for your pain.
Okay, good.
Okay, so if I could just get your name and date of birth.
Natalie Andrico, and 2297.
Okay, and I'm also going to scan your wristband. Excuse me. These gloves can be different for the
Yeah.
Did you scan your wristband? Okay, thank you. All right. I see that your IV site is intact, so that is good. So I'm going to clean it off with an alcohol swab. And I'm just going to flush first, okay?
Okay.
Okay. And this is my flush. Okay, perfect. So, now I'm going to start your medications, okay? All right. Okay, Natalie, so all your medications have been started. How are you feeling?
I'm fine. It feels a little strange, but I know it'll help me. Thank you for making me feel more comfortable.
Absolutely. The doctor will be in here shortly to come and speak with you, okay?
Okay.
Alrighty. And of course, if anything changes, I'll let them know, okay?
Okay.
Alright.
Come in.
Hey Natalie, how you feeling?
I'm okay.
Okay, good.
A
I'm
little
glad they
better.
put the NG tube in.
Yeah.
We're also replenishing your fluids, so you're feeling a little bit better at least?
A little bit.
Good. So I wanted to come in here and discuss some of the treatment options for you. Is that okay?
Yeah, sounds good.
Cool. So we can provide a medication for you that can prevent and manage your flare-ups, like a corticosteroid such as prednisone, or an immunosuppressant such as methotrexate, which will suppress your immune system and prevent flare-ups from occurring. Or, if you prefer not to do a long-term medication therapy, we can undergo a procedure called a strictureplasty. This is a surgery that helps widen the narrowed areas in your intestine.
How long is the recovery time for that?
So the procedure is generally a few hours, and the recovery time is a little over a week.
Yeah, I don't think I want the procedure to be done. I'm struggling financially and really can't afford to miss work to properly recover. I think I would prefer the medication.
Okay, I understand.
So how long will I be on the medication?
So I'm going to prescribe two medications for you, prednisone and methotrexate. The prednisone is going to be for 3 months, and this is going to help reduce the inflammation as well as induce your remission. And the methotrexate is going to be more of a long-term therapy that's going to suppress your immune system.
Okay.
And because you're on the methotrexate, we're going to need to monitor your CBCs weekly for the next 4 weeks to ensure that no adverse effects are occurring.
Oh wow, okay. No problem.
So Mrs. O is at risk for stress and anxiety secondary to her Crohn's disease. So we want to make sure that she feels comfortable with her care and also with her financial situation that we talked about before.
Right. She's also at risk for malnutrition secondary to her bowel obstruction. So we want to make sure that she's receiving IV fluids to provide her with the nutrients that she needs.
And we definitely did start the IV fluids. She is also at risk for dehydration secondary to her vomiting. So we want to continue to monitor her labs and vital signs and make sure that we can continue, to give her the IV fluids.
Right.
And with the vital signs, maybe we should do more of like a routine just to check to make sure that nothing has changed.
Yeah. We can talk to the doctor about that, see how often he wants the vitals checked.
Yes.
And she's also at risk for perforation secondary to her bowel obstruction.
Okay. So we just have to make sure that she, is very vocal about her pain, and if it gets worse, to use her call bell to let us know to come in.
Right.
Okay, and we will also continue to monitor her labs and blood pressure. For the time being, the doctor would like her to stay in PO. We will also auscultate her bowel sounds Q2 hours per the doctor's order. And we also have an interdisciplinary team meeting coming up to just basically discuss her next steps for discharge and medication.
Okay.
All
Sounds
right.
good.
All right.
Thank you.
Come in.
Hi, are you the social worker?
Hi, yes I am. My name's Ashley.
Hi, my name is Camilla, and I am a nurse on Mrs. O's case. And I just want to discuss some patient care about her, and the doctor will be joining us shortly so that we can all talk together.
Okay, that sounds good.
Perfect.
Hey everyone.
Hey,
Hi.
How are
doctor.
you? I'm Dr. LeBoy.
Hi, I'm Ashley. I'm the social worker.
Awesome.
How are you?
Good. How are you?
Good, thanks.
Right. So, how's Miss O doing? I know she's the patient that was admitted on the unit for a small bowel obstruction. Does anyone have any concerns before discharge?
She seems to be doing fine. She does, talk about the pain that she has if she lies flat. But other than that, my main concern is that she will not be able to afford her medication, which could possibly end her up in the hospital again.
Oh, that surely does sound concerning.
Yeah, when I spoke to her about the treatment options, her options were either surgery or medication therapy. She immediately expressed concern that she wouldn't be able to afford missing work for a week, the week recovery period after the procedure. So she wants to go with the medication option, but I'm not exactly sure what her financial status is and what she can afford.
Okay. Well, if you don't mind, when you finish her discharge, I can come with you to talk with her about a website called GoodRx, and that can help her afford her medications at a lower cost.
Okay, yeah, that'd
Well,
be
I
great.
believe that would actually be great. And anyways, you would be a way better candidate to explain to her anyway. So thank you so much for this meeting.
Yeah, I'm glad we have a solution. Thank you for talking, and I'll get the discharge order ready and send it over to Cam.
Perfect.
Thank you.
Happy to help.
Awesome.
But
So because you're on prednisone, that's going to suppress your immune system.
What are you?
I'm still writing, Jordan. Come in.
Hi, how are you, Natalie?
I'm okay.
Hi, well, my name is Camilla, and I will be your nurse here. And oh, crap.
Come in.
Miss O, how are you?
I'm good. How are you?
Good. My name is Dr. LeBoy. How are you? I just asked you that. Start again.